Hi, sorry about that. My video cut off halfway through, but I'm going to go ahead and continue to finish my newborn assessment video. I ran out of storage, so I had to clear some data out. Okay, so where I left off, I hand sanitized, all that, same as before. When I left off, I was talking about skin issues with the baby. We talked about vernix and all of the rashes, stork bites, Epson, milia, the Mongolian bruising, that Mongolian rash, bruise, it looks like a bruise, that could be normal. We talked about the hair that's seen on babies sometimes if they're a little bit early. So then I'm going to go ahead and move on to the cranial assessment part of the video. Here you can see if it was a vaginal birth, baby might have some overlapping of the fontanelles trying to get out of that birth canal, have to overlap to get through the vaginal canal. And so you might see some of the overlapping there, just seeing the soft spot, making sure that's not like too indented and from dehydration or anything like that. If the baby was a C-section, cesarean birth, baby would probably have a really nice round shaped head, and then the suture lines along those fontanelles would be pretty approximated, and that's kind of what you would see with baby on that. And then I'm just going to move down to the sides here of the head and look at the ears. I'm going to pull back on them like this and they flap back nice. So that's a good sign, positive sign. And they're also in line with the eye here, the tip of the ear with the eye. I can see that baby has that, and that would be a good indicator that baby does not have Down syndrome. So I go ahead and do that and it looks really good. I'm going to move into the eyes here. I don't see any drainage. Iris is a nice slate blue color. They're not yellow, so no indication of jaundice there so far. Look at the face. The face and the head isn't yellow. So, and that would be kind of where it would first start if we were seeing a baby who was jaundiced, so, and I'm not seeing that. So, then I'm going to go ahead and I can get my light here and check for any that red eye light reflex in the eye, or reflection back. So I check both eyes for that with the lights. It'd be a little darker in the room, and then I can go ahead and do my perla, make sure that both eyes are equal and reactive to light. And you know, with baby adjusting to distance, that might not be a very good test because babies can only see a certain amount, so a certain distance is pretty close that they can see. So that's why you see like baby's eyes don't appear crossed or anything like that, but that does take a little time sometimes. If baby is cross-eyed, then it's they're adjusting their vision. So eyes look good. No abnormalities there. I'm going to check down in the nasal, the nose here. I'm not seeing any nasal flaring. No, which would indicate, you know, the baby is having some respiratory distress and some issues. They look good. Everything's symmetrical. No milia on the nose, not anything like that. And then I'm going to go ahead and look in baby's mouth. Check for any of those Epson pearls in the mouth, the little white spots. Checking the frenulum, making sure that that's long, otherwise they would have to cut it so the baby doesn't develop any speech issues or having any problems with that soft and hard palate. Suckling down any nutrition, milk. So baby's good. Baby has good suckling reflexes and stuff like that. So not seeing any cleft lip, which would be a problem. They would probably want to get that fixed as soon as they could. So that's really good. And then I'm going to go ahead and check the neck here, checking in the folds of the neck, looking at checking range of motion of baby's neck. Then I can go ahead and just palpate on that clavicle area, and we're looking for any crepitus here, checking the breast tissue, seeing if that has developed nicely, or if the baby is premature, you wouldn't, the nipples would be really flat and you wouldn't get that tissue underneath that you're supposed to have. So those look good. And then I'm just going ahead and I'm assessing the rest of that. And the abdomen is nice and round. Baby's got a nice full tummy. I don't see any retractions of her chest. She's not having difficulty there with breathing, retractions of the accessory muscles either. She's good there. That all looks good. As far as the umbilical cord, it looks great. There's no bleeding. It's drying up nicely. We just leave it. We don't do the alcohol anymore to dry it out, and you just leave that. As far as the hands go, I'm looking for that simian line. It's just one straight through line, but what I really want to see is the 2 lines. 2 lines, 1 line would be a genetic malformation. So looking at the hands for that as well. I can go ahead and check baby's hips, just kind of as I'm moving down here, rotate the hips. If I feel any disjointing, anything abnormal, baby's hips are off, I'm going to want to indicate that, because that can lead to some spinal problems later and stuff like that. So then I'm going to go ahead and I'm just going to go ahead and I would sanitize, get my, I suppose I could use gloves for this part. I'm not sure if you need to or not, but looking for the meconium, anything like that. So if baby, I'm looking at if there was a circumcision, making sure that that's healing up nicely. Whoa, no signs of infection, anything like that. Making sure the urethra is midline and not up, facing up or down the whole of the urethra, because that would be bad and have to be corrective surgery. I can see that the scrotum is descended, and I see the rugae of the testicles if it's a boy. So that's nice. They come in, they're developed. And then for the female, you would see labia majora and labia minora would be, the majora would be covering that if baby was, term, and then, if the baby was preterm, you might see both equal or maybe less developed majoral labia. So just looking for that when you're looking and you're seeing that. And if you do see any little bit of, it's like baby menstruation, can't remember the name, but that can be a normal sign. It's like a sympathetic type of period, basically. So you can go ahead and put baby back up. And then we did the reflexes in the feet and stuff like that, and then looking for the same lines and stuff like that in the feet. And then I'm going to move baby onto her back here. And when I'm checking the back, I'm looking at the base of the spine. I see the little dimples, those dimples. Looking for good alignment here. Looking for any signs of spina bifida. If there was a big patch of hair here, that might indicate spina bifida. And then, at this point you can check for rectal patency and seeing that there's meconium passed, and that looks really good. So baby's looking great. Did height and weight and vitals, did our cardio screening, did our assessment there. And then as far as, I guess, bonding maybe might be my last thing to cover with this, but making sure bonding and latching with baby, if baby's breastfeeding, and just following up with mom and about all those bonding techniques and things that we talked about. So, all right, that completes my newborn baby assessment. Thank you.